Good morning. This is Dr. Azar with Genesis Medical Center, and it's on ShuraTV. Welcome to another program. Here we are, November 2nd, 2021. We wanted to discuss with you today the advent of all these COVID boosters getting approved. And also we have the vaccine that has now newly been approved by emergency use authorization for children 5 to 11. We'll discuss that a little bit. I wanted to just give an update on those things and see what's going on so that you're well informed on what to do and what not to do in terms of COVID boosters and vaccines and the COVID numbers in general. As you know, we are still in a pandemic. Numbers in Europe are going up again. China, once again, closed down a couple of cities because the numbers had gotten out of hand. So it is very important for us here in Southern California, the U.S., to try to get the bull's horns on this pandemic. And the only way to do it is for us to, number one, be aware of what's out there for us to help us prevent getting the COVID. And if we've got it, we have to follow the CDC's guidelines so that we don't get it again and we don't spread it or become a silent carrier. It's very important. So as far as boosters are concerned, we have the Moderna booster and the Pfizer booster that have been approved. And across the board, 65 and older, if someone's living in a long-term care setting, and the key is for it to have been 6 months post your second vaccine. So if you're someone that got the vaccine and it's been 6 months post-vaccine, then you would be eligible. If you're 65 and older, you live in a long-term care setting, you have an underlying medical condition, diabetes, cholesterol, autoimmune disease, rheumatoid arthritis, anything, heart disease, kidney issues, anything like that, failure to thrive, fibromyalgia, these kind of things. If you have any of these things, thyroid disease, hyperthyroid disease, hypothyroid disease, any of these issues, you are eligible to go get the booster. And I encourage you to get it. I got my booster last Friday. On Saturday, I was a little bit tired, a little bit soreness on the hand. Other than that, nothing to complain about. Everything went very well. I got it. I got my parents to get it. I got my daughter got it. My wife got it. We all got it. Everyone is fine. Here we are Tuesday. We got it. We got the booster. It's half the dose. It's better to be safe than to be exposed to the variants that possibly might come up. So it's very important to keep that in mind and get that. Also, if you live or work in a high-risk setting, health setting, if you work for a lab, if you work for, there's a lot of COVID testing labs nowadays. So if you work for any such entities, it's very important that you go and get your boosters. If you haven't gotten the vaccine, please go get it. They're all over the place. You can go get it very quickly, and that'll be very good. If you've had COVID-19 and you've had corona, obviously it's important for you to follow your doctor's orders, and usually within 3 months past the time you had it, you can go ahead and get the vaccines. Usually they require only one vaccine from you because you do have built up natural immunity as well. So that's the story right now. That's the situation. The numbers, fortunately, in the U.S. are down, specifically in California. California has the lowest case rate by percentage, which is good. Over 70% of the Californians have had at least one vaccine or more. So that shows and illustrates to us that the vaccines are working against this virus. Just like when you have a bacterial infection, the doctor gives you an antibiotic to take. You take the antibiotic. There are some side effects, but you still take the antibiotic to get rid of that bacterial infection. For viruses, there's no antivirals that are that successfully illustrated eliminating the virus. The vaccine has been by far, specifically for COVID, the most effective regimen to prohibit the proliferation and growth of COVID in society. So if you take the vaccines, you're helping COVID get eliminated from society or decrease in high numbers, and you decrease hospitalizations and deaths from the COVID virus. You might see a lot of propaganda. You might see a lot of sorry about that glitch. We're back on, I think. Thank you. Um, so basically, it's very important that we take this seriously. We're at the almost, we can say safely that we're at the end stage of this pandemic. Places are opening up, people are traveling, and if we want this to continue, we should try to abide by the CDC, the World Health Organization, the medical community, the scientific community, and what they're telling us. I would encourage you, if you're someone who has followed the alternative narratives to COVID, which are close to conspiracy theories, um, it's important to get serious and take care of your body and protect it from these potential viruses. Um, COVID has killed more than you know 5 million people. It's very deadly, and we've seen it. It has happened in the last year and a half. And if in the beginning everyone abided and got the vaccines, we wouldn't be talking about COVID now. It would be something very minimal in our lives. But unfortunately, it is still affecting our lifestyles, our day to day interactions, our meetings, our travel patterns, and our life in general. And if we want it to be something which we can look back at, we must try to get ourselves on the right track in terms of protecting ourselves, our families, our children from getting this virus, because it is fairly virulent, and people, when they catch it, they do pass it on to others. There are schools and settings that right now, sports settings, that people are getting it and passing it on, and they're isolating themselves for 5 to 14 days depending on their condition. So this is something where we need to keep in mind and keep vigilant about. And it's a reality of life. There's nothing that we can sit and deny. And as far as vaccines and their effectiveness, there's been given worldwide more than 6 billion doses of vaccine. And if 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 these vaccines were truly bad for you or truly had those negative side effects, you would have seen masses of people coming out from the woodworks claiming vaccine side effects. And that is just not the case. We don't see it. We don't see it in our clinics. We don't see it in our society. We don't see it anywhere. You'll see some mild issues that have come up, but even then, the risk and reward need to be measured, and the reward is much greater than the risk. Because if you talk to someone that has had COVID and that has really gotten knocked out, or God forbid, their family member has passed away, it's a devastating problem to have. And we want to be as far from it as possible. And the best way that we can do that, known right now, is to have ourselves and our loved ones up to 5 years old vaccinated. And fortunately, the new 5 to 11-year-old vaccine has gotten approved, emergency use authorization. It's a smaller dose, but it'll increase the antibodies to COVID in the body so that the children are protected. Right now, most of the hospitalized people, 90% plus, are unvaccinated individuals. And that is unfortunate, because, especially living here in California, we have access to the vaccine. We have in any pharmacy that you go around, there's the vaccine is available. You can take it. It's preventable, and it's really a big tragedy where we still have people with COVID in the ICU in some of these states. It is very, very tragic, and it's something completely preventable. So I urge you and I implore you to try to go and get yourself vaccinated if you're not vaccinated. Do not believe the conspiracy theories. Do not believe these side stories. The vaccine does not make you infertile if you're a female. I've heard this multiple times from multiple people. This is completely false. Completely false. The birth rates have not been affected by this mass vaccination campaigns. People are still having babies. I'm sure you know someone who's had a baby and they've been vaccinated during this epidemic. There's been many births, and people continue to procreate. That hasn't been a problem here or elsewhere internationally. So these kind of things, or some people say that, oh, this vaccine traces you and it tracks you, and it keeps abreast of what you're doing and what you're not doing. The fact that you carry a cell phone, you're trackable, and what you do and who you call and what you're doing in terms of your online activities, you're traceable and trackable. You sign that away every time you download an app that silently follows you and sees what you're doing and where you are. So these things are nonsense. It's complete nonsense. Don't fall into that kind of thinking pattern. People don't really worry about what you're doing, and especially living here in California in the West and in the U.S. Everyone has the liberty and the freedom to live their lives. No one's worried about what you're doing specifically on a day-to-day basis. So these vaccines certainly are not traceable in your body, and certainly are not for the purpose of tracing you or controlling population genetics. These things are just completely, absolutely, delusional thoughts, as I would say. So don't fall into that. Again, we encourage you, especially now that you have, the pediatric approval of this vaccine for 5 to 11-year-olds. It's a lower dose. Um, they've read all the safety studies. It's been relatively safe for everyone. There was an issue of myocarditis earlier on in males 18 to 24. They looked at that, and the numbers did not increase. There were some that have had a sort of a little infection in the myocardium in their muscle, but that was resolved, and it wasn't something which prevented people from having the vaccine. Um, so it's something which is safe and effective. And again, if we want to get rid of this pandemic and move on with our lives and have everybody open up and all the regular amenities of life move forward, please get your vaccines. Please get your boosters, especially if you have seniors that you're taking care of, and the seniors themselves, they need the boosters after the 6 months after their second dose of vaccine. It's important. You want to keep everybody safe and sound. It's specifically in terms of a lot of these international cases that we see, like right now in Europe, the numbers are increasing a little bit again, and as well as Russia. Russia had a complete close down this last week, and because people are not abiding by the regulations of their health authorities. And it's simply said, as I said earlier, vaccines are for viruses like antibiotics are for bacterial infections. You take them. They have some side effects, but you take them because in the long run and in the total sum, the benefit outweighs the risk. And that's something to keep in mind. And we're fortunate that we have access to these things here living in the West. There's multiple numbers of people that they wish they could get their first vaccine across the world, and they just don't have the means, and there's the resources in those countries, and they don't have them. So again, I encourage you to get them. I hope that you understand this plea. Talk to your personal doctor, talk to your personal medical group, whoever they are, and discuss it. And if you have any doubts, discuss it with someone and get rid of those doubts. These doubts are completely false and constructed to just cause controversy and keep you from getting on a healthy path and live your life to the fullest. So it's very important to do that, and we don't want to consume hospital and medical facilities for COVID cases. It's just ridiculous. It's preventable. Why not go and get your vaccine and keep yourself from getting hospitalized or near death with COVID? This is something completely preventable. I encourage you to go ahead and do that. You're wasting resources. Someone with a stroke or someone with a heart attack comes into the ER, and some of these ERs are packed because they have COVID patients that were completely preventable. Something completely preventable. Hospitalization from COVID is completely preventable now, and we as human beings need to take initiative and seek the means through this vaccine to keep us from getting into hospitals. It's very important. Just this week I ran into 3 to 4 people that got COVID right here in Los Angeles County, and it's because they were reckless, and 3 of them were, they hadn't gotten the vaccines because they don't believe in it. This belief system has to be questioned. If you don't believe in it, based on what? Based on what? You don't believe in it based on propaganda, based on stories you hear. We have to smarten up as individuals and really do things for the betterment of society and living in general. That's very important. That's my message to you today. Get the COVID boosters, get your vaccines if you're not vaccinated, get your children vaccinated, 5 to 11. Your local office should have the vaccines, or the local pharmacy. Please call your doctor, discuss with them. If your child has any type of immunodeficiencies, any type of underlying conditions, talk to your doctor about the vaccine and get it, especially now that they're going to school and school's open and they're interacting with people every day. We do testing for multiple schools. We still see it. There's still people that have COVID. So it's important to get your kids protected. It's a responsibility for everybody. And please don't lag or don't drag your feet on this responsibility. It's something which will get us back to normal life quicker. And I urge you and implore you to take it seriously and live your life to the fullest and get your vaccines and get your boosters so that we can look back at COVID and say, bye bye, COVID. With that, I'd like to thank you for joining us today, and we'll get with you next week on another topic. Thank you very much, and you guys have a wonderful week.